Hello, my name is Robin Desrocher, and I am the Director of the Risk Management Department at Texas Medical Liability Trust. Not all medical liability cases are prompted by medical errors. Patients often cite interpersonal reasons such as poor communication or feeling rushed as the basis of their decision to sue or file a medical board complaint. This video describes 5 common issues that can increase the risk of a malpractice claim or medical board complaint. Issue number 1, failing to listen, communicate, and spend adequate time with patients. Research on why patients sue physicians has repeatedly shown that basic interpersonal skills, such as listening and showing respect, can be as important as clinical skills in preventing or causing lawsuits or board complaint investigations. Maintaining eye contact and listening attentively can go a long way toward building a positive relationship with your patient. Patients who have good relationships with their doctors are less likely to sue if an adverse outcome occurs. Another key factor in building a positive relationship involves the quality of time you spend with your patient. Short visits can be effective if the physician sits down, listens to the patient, asks appropriate questions, and allows time for dialogue. If you do not make eye contact or acknowledge your patient's concerns during the visit, patients may feel rushed and disrespected. They may not provide you with complete information about their condition. How can you help make your patient's visit more satisfactory? Schedule the length of the appointment based on your patient's needs. During the appointment, spend a few moments connecting with your patient on a personal level. And before your patients are taken to the exam room, make sure they have indicated the reason for their visit. Issue number 2, maintaining illegible, inaccurate, or incomplete documentation. Ask yourself, what would your medical records look like to another physician, a plaintiff's attorney, or a jury? Accurate, legible, and complete documentation can be your best defense against a malpractice claim or board complaint. Poor documentation can not only impede patient care, but can reflect poorly on a physician during an investigation of the care provided. Also, medical boards will discipline physicians if their records are incomplete. Make sure your documentation is in compliance with your state board requirements. A common problem area involves the use of templates with an electronic health record. Templates can save the physician time while documenting patient encounters, but take care to use them thoughtfully so that notes are still accurate and complete. When using pre-formatted text or templates, edit entries to ensure the record accurately reflects the care delivered. Avoid relying on pre-populated or default text in the template. It also is important to update each encounter note to reflect the patient's current symptoms and to check for unintended system defaults to normal or negative. Make sure your entries do not contradict the patient's present condition, symptoms, or chief complaint. Another documentation issue involves making changes to medical records after an unexpected outcome or notice of claim. Even if you think new information will help your defense, altering the medical record after the event is detrimental. When an addendum is appropriate, ensure it includes the date and time of the addendum, a reference to the date and time of the original encounter, your reason for the addendum, the added information, and your signature. EHRs typically have an addendum process built into the platform that captures these elements. Reach out to your EHR vendor if you are not familiar with this electronic process. Issue number 3, failure to order and follow up on tests or a delay in ordering tests. Use a tracking system to ensure that your patients have obtained recommended tests. A tracking system can lead to better patient care and can minimize potential allegations of failure to diagnose and treat. Along with a system for tracking results, develop guidelines for handling test results when they are received and for following up on outstanding orders. Avoid using the no news is good news approach for dealing with test results. Consider adopting processes that utilize reminders and alerts. Specify in the guideline that test results should be thoroughly reviewed before they are placed into a patient's chart. The medical record should reflect who reviewed the result, along with the date and the time of the review. Notifying patients of their test results in a timely manner should also be a high priority. Documentation should include when the patient was provided with the results and the name of the person who contacted and corresponded with the patient. Issue number 4, failure to refer when appropriate, failure to track referrals, or failure to communicate with the referring physician. Implementing a system to track referrals provides a method for verifying that the patient keeps the appointment, confirming receipt of the consultant report, prompting a call to the patient or consultant if a report is not received, ensuring the physician reviews the report, and arranging for a follow-up appointment if necessary. If your patient fails to keep the appointment you recommended, remind the patient of the importance of following through. Document these communications and any informed refusal in the patient's chart. A lack of communication between physicians can also be problematic. Written communication is often satisfactory, but there are situations in which a phone or in-person discussion is warranted. Document discussions with other physicians and any shared treatment plan that results from a referral. Issue number 5, medication errors. Medication errors that can lead to claims of malpractice include failing to check the patient's record when prescribing medication, prescribing improper dosages, failing to advise patients of potential side effects or interactions with other drugs, prescribing drugs the patient is allergic to, prescribing drugs outside the physician's specialty, and prescribing drugs for non-patients. To avoid allegations related to improper prescribing, consider the following guidelines. In the patient's record, maintain a list of all medications prescribed and drug allergies. Update this information at each visit. Check the patient's medical record and review all medications and allergies before prescribing a new drug or refilling a medication. When writing a prescription, educate the patient about the drug. Document any discussions and educational materials provided. Refer the patient to a specialist if a required drug or treatment is outside your scope of practice. When prescribing drugs off-label or in dosages exceeding those recommended, document your rationale. Also, document that you discuss the drug's risks and benefits with the patient. If a patient calls to report side effects or unusual symptoms, the prescribing physician should be alerted. Review any applicable state laws for requirements regarding opioid prescribing. Thank you for your time and attention. We hope you find this information helpful. For more information about TMLT's risk management help and services, visit us online.